Schultz-Dale phenomenon is an example of option A. Anaphylaxis, option B. Atopy, option C. Delayed hypersensitivity, option D. None. Answer is option A. Anaphylaxis. Which is not a primary mediator of anaphylaxis? Option A. Histamine, option B. Heparin, option C. Melatonin, option D. Serotonin. Answer is option C. Melatonin. The animal serum used by Arthur when he observed Arthur reaction was option A. Rabbit, option B. Sheep, option C. Horse, option D. Man. Answer is option C. Horse. Serum sickness is an example of dash hypersensitivity reaction. Option A. Type 1, option B. Type 2, option C. Type 3, option D. Type 4. Answer is option C. Type 3. Jones-Mott reaction is a dash. Option A. Delayed hypersensitivity reaction. Option B. Cutaneous basophil hypersensitivity. Option C. Both A and B. Option D. None. Answer is option B. Cutaneous basophil hypersensitivity. Hashimoto's disease is an example of option A. Localized autoimmune disease, option B. Generalized autoimmune disease, option C. Disease of CNS, option D. Disease of liver. Answer is option A. Localized autoimmune disease. Polyarteritis nodosa is a option A. Systemic autoimmune disease, option B. Organ specific disease, option C. Both A and B, option D. None. Answer is option A. Systemic autoimmune disease. Graft between members of different species are option A. Xenograft, option B. Sorograft, option C. Serograft, option D. None. Answer is option A. Xenograft. Ewald-Simster effect is option A. Autoimmune disease, option B. Hypersensitivity reaction, option C. Unilateral sex-linked histocompatibility, option D. None. Answer is option C. Unilateral sex-linked histocompatibility. Metchnikoff discovered option A. Plasma cell, option B. Phagocytic cell, option C. Platelet, option D. RBC. Answer is option B. Phagocytic cell. Concentration of formalin used to prepare Vidal antigen is option A. 10%, option B. 40%, option C. 0.1%, option D. 1%. Answer is option C. 0.1%. Immunoglobulin indicative of intrauterine infection in newborn is option A. IgG, option B. IgM, option C. IgD, option D. IgE. Answer is option B. IgM. In healthy person, presence of antigen specific IgG is indicative of option A. Recent infection, option B. Past infection or immunization, option C. Past infection, option D. Vaccination. Answer is option B. Past infection or immunization. Reaction of soluble antigen with antibody is known as option A. Agglutination, option B. Precipitation, option C. Flocculation, option D. Complement fixation. Answer is option B. Precipitation. Reaction of particulate antigen with antibody is known as option A. Agglutination, option B. Precipitation, option C. Flocculation, option D. Complement fixation. Answer is option A. Agglutination. Vidal test is done to detect option A. Typhoid, option B. Rheumatoid arthritis, option C. Syphilis, option D. Atypical pneumonia. Answer is option A. Typhoid. Vidal test is a option A. Slide agglutination test, option B. Tube agglutination test, option C. Slide flocculation test, option D. Tube precipitation test. Answer is option B, tube agglutination test. Diagnosis of typhoid in first week is by option A, Vidal test, option B, stool culture, option C, urine culture, option D, blood culture. Answer is option D, blood culture. Which of the following antigen is not used for Vidal test? Option A, Salmonella typhi somatic antigen. Option B, Salmonella paratyphi somatic antigen. Option C, Salmonella paratyphi A flagellar antigen. Option D, Salmonella paratyphi B flagellar antigen. Answer is option B, Salmonella paratyphi somatic antigen.